It's so funny that I am listening to podcasts. I mean, I always listen to podcasts. I don't know if I've said this before, but I am a podcast junkie. I just love them. I have my library going, and I always have at least maybe one AirPod or one little earpiece if I'm not into the transmissions going through my brain some days. Anyways, I'm always listening to one, and unless I am speaking, which has recently been a lot more. I'm doing coaching calls and filming my courses and talking on other calls and client calls and partnerships and now this my own podcast. I'm just talking all the time now, but anyways, when I'm not talking, I'm listening to a podcast or an audible book. And today I was just listening and bam, out of nowhere my own voice came up. So I guess this podcast is on my loop now, and it's kind of surreal to just listen to your own voice. And yeah, I took myself up on it and I said, yeah, I should probably listen. I record these, and then no matter if it's an interview or like a medical story, history, I just record them. I don't edit them. I don't listen to them. I just send them off to Darby for her to do whatever she needs to do to make it sound okay. And so when I listen to it, I'm like, whoa, what was I saying? What am I talking about? And then I listen, I'm like, oh, dang, that's pretty interesting. Except for the interviews, I realize that I probably talk a lot, maybe too much. I don't know. Tell me give me some feedback here on how these interviews are going. And I never mean to talk over anyone or not let them respond, but I just get so excited with what we're talking about. And it's just something for me to work on. Like, ask a dang question and let them answer. But whatever, I'm trying. Okay, stick with me, guys. I'm going to get a lot better at this, and I want to know what you're interested in and what questions you like to ask. So for now, I just kind of have to go inside and ask questions from what I feel that my clients and my audience want to know, and then yeah, let them talk. But I've really enjoyed listening to the episode with Dr. Jocelyn Rodriguez. I'm halfway through, and she's just so delight. Her the way she speaks is just so calm and reassuring. And I hope that all your caretakers and your team make you feel that way. Just a nice space that you feel welcome in and heard. Guys, it's so important to feel heard. So I really hope I hope you take this in mind, and I can also provide a space that you feel this way, because at the end of the day, I am representing the healthcare system, and I am a nurse, and I'm proud of that. I do acknowledge that the system is broken, as with anything. We are imperfect. We're imperfect beings, and but we do mean well. We're not here to hurt you and we do really deep down want to do things right. We want to get it right. And it's just over years, over hundreds of years, we have been so formed and trained as people and as a society and as a culture to work a certain way because that's what works. And then we're hoping to improve it continuously. And sometimes we go too far. So we need to bridge this gap between the natural and holistic type of birth, one that trusts the mom's body and trusts her ability to give birth and to do it right and to take its time, but to also be able to assess and jump in when needed, because these interventions have been developed for a reason. But are the reasons necessary if we don't jump in, right? So uh, I'm kind of, we're always talking about this. We're always seeing what is necessary or what is the best thing to do for you and for your baby. And then also for as a community and as a society. And I hope this thought process and these kinds of discussions and this kind of education will steer us in the right direction, maybe slowly, but in the right direction. And that's what I'm hoping to do with my friends a nurse and with the Birth Link and teaching clients, and then also speaking about it to those in the hospital system as well. Because I know there's way more that are on my side and that feel the way I do than not. And it's going to take It's going to take an army to steer this ship. And so I'm so glad you're here and you're listening, and we're discovering your options and educating ourselves. So we're going to continue on this first 15 series and dive in a little deeper with the cord blood. I know we got into the history 2 weeks ago. So now I want to we're going to reiterate the benefits of cord blood and delaying cord clamping and what exactly are the current recommendations and practices of the hospital and your doctors. And then I want to get into cord blood milking on top of it for babies that are coming out and they're not that active. And maybe it's not an emergency, but it's kind of urgent that we get them over and we help them transition. What can we do to kind of give them more of that blood? Well, cord milking, and we'll get into that one. And then if we need the cord blood to either save it for later or we need it for someone in our family that's sick, how do we collect the blood and bank it? Or what are our options? What are the costs? What are the benefits? And what are the risks of that? Why would we not want to do it? Let's get into that today. Thank you for listening. Let's get started. Welcome to the Birthling Podcast, presented by My Friend's a Nurse. I am your host, Colette McCullicher, a high-risk labor and delivery nurse right here in sunny California. I'm also an OB certified specialist, birth educator, lactation expert, and mother of 2 beautiful daughters. I am passionate about guiding you through the miraculous journey of pregnancy and childbirth, using evidence and history and asking the reason why. I have some incredible medical friends and colleagues, and we're all here to help you navigate this often overwhelming birthing hospital system in the United States. My goal is to gain trust in birth, improve this system, and provide some valuable insights. Let's make this journey a little less daunting and a lot more joyful. Let's get into it. So when we received more and more evidence of cord blood benefits to newborns, yet it was very difficult to change that practice, right? It took almost 50, 60 years for us to do so. First, we started with preterms only, with our preemies, providing the little ones with an increase of blood volume and increasing their iron levels. It's lowering their needs for blood transfusions, and it improves their lung transition and breathing. It also has neuroprotections and development. This shows a difference at the 12-month mark in many of the studies that have been done. It also decreases risk for intraventricular hemorrhaging or brain bleeds. And it reduced risk for necrotizing enterocolitis, which is a really serious GI condition affecting these little ones. As they discovered, benefits were also there for term babies. So all of these same benefits for the preemies, as much as they need it, were also there for term babies. So we know these benefits, right? It increases the red blood cell volume, which improves the ability to carry more oxygen. It regulates the blood pressure and builds up those iron stores for up to 6 months, so that they're going to be less likely to be iron deficient. And that is so important for their growth and overall development. There was a study published in the Journal of Pediatrics that found that infants who had delayed cord clamping had more myelin. So myelin, myelin, it's a brain insulating material in their brains by 4 months of age compared to those whose cords were clamped within 20 seconds. That myelin is produced by iron-dependent brain cells, and it accelerates communication in the brain. So it helps these neurotransmitters speak to each other, which is so important in those first years of life, especially that first year. There's nothing growing faster than a baby's brain. So it has the potential to reduce the number of babies that die or have neurodevelopmental impairments in their early years, right? So very important, these benefits when it comes to getting all their blood, if I do say so myself. But now the common practice in hospitals, because of all this evidence, is delaying cord clamping by 60 seconds. This gives about 80% of the fresh, nutrient-rich blood from the placenta to your baby. The American College of Obstetrics and Gynecology, that's ACOG, and the American Academy of Pediatrics recommends 30 to 60 seconds for mostly vigorous term and full-term babies. So their backing it up. So not only the preemies, but vigorous term and full term babies. The World Health Association is recommending waiting 1 to 3 minutes in general. They're seeing the benefits of this and getting 100% of the blood, especially all over the world. All right, great. Benefits, check. And doctors on board. So why would you not want to delay cord clamping and cutting the cord immediately? Well, one that comes to mind immediately is that mom is hemorrhaging and it's an emergency. And mom and baby have to be separated really quickly to manage that and stop the bleeding immediately. If we need to provide baby ventilation and resuscitation, and we know right at birth that this is going to be an emergency, then we separate the baby and immediately take them over to perform resuscitation measures. These two reasons are probably the main reason that you are delivering at the hospital with us. So for us to assess and act quickly, that's why we're there for emergencies just like this. And that's when we can't delay for your blood, right? But not every delivery at the hospital is like this. And actually, most are not. So for most, delayed cord clamping, whether it's 30, 60, or even if 60 seconds or even a few minutes, it's a choice that you have. If you want to wait until the cord stops pulsing and it turns white, giving your baby all the blood, discuss that ahead of time with your doctor or midwife and put it in your birth plan. A reason you may choose to clamp 30 seconds or less is that you want to collect the blood to use later. We'll get into this reason more in just a minute. But first, as I always say, we need to know the benefits. But also, we got to know the risks. And there are a few risks to getting so much blood as a newborn. So let's talk about it. Extra blood, it's going to increase or lead to an increased oxygen-rich red blood cell count, right? Obviously, you're going to have some really great fresh blood, even more than you probably normally would. The baby's brand new, a little bit underdeveloped liver and gallbladder are the ones that are working to break this extra blood down, right? When they break it down, we have bilirubin that is in our system to do that. An increased then need for this breakdown is going to lead to too much bilirubin in the blood. And this is what causes that yellow tint on the baby's skin. So it'll be on the belly and the back and your face and then arms and legs and even in the eyes. Too much bilirubin can cause damage to the brain. And it could take a day or two to develop. So sometimes after you go home is when you notice it. Fortunately, though, the most dangerous one, the most dangerous type of jaundice, which is what this is, develops within the first 24 hours. And usually you're going to be at the hospital for this being one of the reasons. And we test the baby's bilirubin using a transcutaneous bilirubin monitor. Just kind of touches the skin and it's able to give us a reading of how much bilirubin is in the blood and on the skin. And if it's high, then we'll have to do a blood test. So we'll be able to catch that early on. And the rest of the types of jaundice with the extra bilirubin coming around is just because it's taking a long time to break it down and get rid of it. So sometimes you need to add a little formula or you just need to get your baby into the sun and help them out. If it's super high, so usually I think it's over 16 with a blood test, then you'll have to add a little help, which is the phototherapy. And it's a blue light. And that's going to be used to break down bilirubin. Okay. So that's one of maybe the most discussed reasons or risks to delayed cord clamping, right? Another one might be, and it's very rare, but to have some breathing problems, right? They have this extra fluid now, this extra blood, which may make it harder for the amniotic fluid that's left in the lungs and the gut to get absorbed as quickly, right? But remember, though, the used blood that the baby has before it's cut is leaving the baby's body. So it's still pretty balanced on how much blood is still in the system. It's not going to be overloaded, but there is a chance that there's a little bit more fluid than normal. And that, especially if also they've received a lot of fluid through mom intravenously, like if mom got like 3 liters while she was pregnant, and that fluid has to go somewhere. Sometimes it's going to go to the baby too. So this is an added risk that they're not going to be able to absorb too much more fluid, including what's in their lungs and their gut. So either way, those are some of the risks of delaying cord clamping. And I think it's really, really important to discuss that with your doctor, with your provider. What are the risks? As you're talking about delayed cord clamping with them. Is there any way then that we could still get the benefits of delayed cord clamping if it is an emergency? Because I did mention a couple of times that we won't be able to give it. It's an emergency. We have to separate baby and mom right away, right? Well, this is where cord milking comes in. If you haven't heard of this term, fairly new to me because I really don't see a lot of doctors doing it in emergencies, but or even just not an emergency, but I would say more of the baby's not vigorous, right? Baby's not coming out screaming, crying, and we're not like running, but we're like, hey, baby, we got to take you over and give you some oxygen. And we may have a few seconds to do that. Well, cord milking is getting some extra blood that's already in the cord to mom quickly to baby quickly. And it's just kind of exactly what it sounds like. We're just going to milk the cord and get the blood quickly into the baby. Does that make sense to you guys? So we're pushing. Okay, so this method is going to get about 30% of blood. That's sustaining, iron-rich blood, neuroprotections and hormones, all that stuff, quickly to the baby. So it just takes a few seconds to milk the cord, and they get a little added benefit. It's not going to be 60 seconds worth because we really got to get baby moving. But it can be really beneficial. So ask your provider if that's something that they do. What do the recommendations from ACOG suggest? Well, they've been changing, actually. I think when they released their first statement regarding cord blood milking, it was in December of 2020, and they said that, I'll just quote it here. It says, given this most recent data, cord milking should not be used for extremely premature under 28 weeks. Extra flow of blood very quickly can harm the brain, breaking blood vessels, and there is insufficient evidence to support milking over 32 weeks. So they really didn't have the evidence. They're like, we can't recommend. They won't recommend something unless there is enough evidence to back it up. So there wasn't. So it's not that they were saying they are against it or that there were known risks. It was just unknown, right? Well, 3 years later, only 3 years, they changed their stance. I believe this was in February. But the latest revision in February of 2023 adds to their recommendation for cord blood milking for non-vigorous term babies. So the babies are just not good tone. They're not crying. They're not doing a few of the things that we would love them to do within the first minute. And sometimes these babies take a little bit to do them, right? But we're already kind of feeling like we need to move them. The cord milking instead of immediate cord clamping for babies over 35 weeks is their recommendation for either vaginal and C-section, 4 strokes. So 4 times is plenty, it's enough, and move it along. In studies that they did review, there was really no significant difference in the number of babies that were admitted to NICU from those babies that got their cord clamped immediately and those that got the cord blood milked. But they did show really great benefits and recovery during their transition in NICU and beyond. So term, yes, they're on board. Preterm, no. Under 35 weeks? No. Because of just too much blood coming too quick, their little tiny blood vessels are not able to withstand that, and you're going to have some bleeds. So speak to your doctor before. I would love to know if it's something they do and offer and that you're aware of, and then everyone's on the same page if needed. So then this blood that we've been studying, we used to collect it, right? We used to collect as much as we could. Now we know it's better that it's going to baby. But we pushed research and treatments for so many diseases and disorders, and that we created these public and private businesses to do so. So we have all these businesses like trying to collect that same blood that now we're trying to give to the baby, right? Learning more and changing our practice to allow the baby to receive most of its own blood is now competing with these collection banks. It's competing with the research that's being done in those treatments. So the ethical issue arises now. Is your baby allotted the value of its own blood? Or is it a better value to be collected and used later, maybe for the community or for someone that really needs it to survive? This is right now a personal decision, and not one. It's not one that we want to make in a rush. We want to make it before we go to labor. And I see a lot of parents asking me in the labor room, should we do it? Did you do it? What are the risks? Why would I want it? Like, they're asking me all these important questions the day their baby's coming. And I was like, oh boy, I can help guide them pretty quickly. So it's not a big deal, but also for me, at least, it's an important decision. It's a thought, like it's a process. And I'm glad you're listening to this episode and taking it to heart. All right. Let's talk a little bit about this blood, this special blood that we're going on and on and on. What's so special about it, right? So the umbilical cord fluid, it's loaded with stem cells, or at least a little bit, enough, right? It's actually not as much as you would think, considering how much we talk about cord blood banking and stuff, but it's enough for the baby. But is it enough to be collected? The cord itself, though, the actual cord, specifically the part that's called Wharton's jelly, is where most of the stem cells are stored and where a lot of research right now is being done. Stem cells, what they are themselves, are immature cells that they can assume the form of other cells. So they can become whatever they need or need to be. These are special cells called hematopoietic stem cells. I know it's a big one. These stem cells are immature, like I said, and they can develop into any type of blood cells, such as red blood cells, white blood cells, and platelets. So these cells specifically can be used to treat blood diseases like leukemia or sickle cell anemia and some immune disorders, which can disrupt your body's ability to defend itself. Transplants, so transplanting stem cells into a recipient that has this disease, are able to treat more than 80 blood cancers, bone marrow failure, and immune disease. In other areas, cord blood therapies are being studied for nerve, heart, bone, and metabolism diseases, especially in regenerative medicine. So very cool. Many of these diseases are inherited, though. They're genetic disorders where another donor without the same genetic makeup is going to be needed for a match. So we're going to go into this a little bit more. Okay, so if you're banking on the slight chance that your baby will need his own stem cells someday, just know that there are many disorders that are genetic. So providing more of his own genetic makeup won't be solving the issue, and he will end up needing stem cells from someone other than himself anyways. So a family member or from a public bank. Okay, so just keep that in mind. And also keep in mind that, like I had said, the cord blood itself doesn't contain many stem cells. So an adult needing a transplant may need multiple donors, not just the one. So if your baby needs his own blood, it may not be enough anyways. He's still going to have to they're going to ask a family member or go to a bank, a public bank. Also, storing privately as an insurance plan can be very expensive. and usually are only allowed to bank for 18 years, maybe 21 years, and some longer. So make sure that you're confirming that option with the company you choose. They're going to charge the fee for processing. That could be over $1,000, maybe more, maybe less if you get a good deal, but it's going to be around there. And then annual storage fees for a few $100s each year. Ask around and speak to your provider. Sometimes they know some great deals, or they have a little discount. This could actually be another ethical concern. Like, how are these companies marketing, and how are they pushing this quote unquote insurance narrative without giving all the data and facts, right? And are they including doctors in their ploy to push? I think now with the new recommendations, that's becoming less and less, but I still see doctors getting a little bit of a kickback when their patients get cord blood. So if you need it, and we'll go into the reasons why it could be a really good idea, then great, get that discount. If not, it's something your doctor's just trying to, for no reason, tell you about it. I would just be a little wary. Like, why? and talk to them about it. Like, well, what's the difference? Do you recommend delayed cord clamping or collecting the blood? Why and why? You got to hear their perspective sometimes. Well, I don't know. Let's talk about why. What are they? What are the data? What's the data? What's the facts? How am I going to use this stuff, or am I wasting my money? Well, thousands of life-saving transplants are done every year using blood stem cells. In the U.S., 1 in 217 people in the U.S. are going to need a stem cell transplant by the time they're 70 years old. And more research is coming. In a study in 2008 published through ACOG, the chance of a child or family member needing a stem cell transplant is about 1 in 2,700. About 3% of deliveries in the U.S. collect and bank cord blood, and this is actually the highest in the world. Another study says that the chance that a child will use their own cord blood over their lifetime, so this is an important one, what is the chances that my baby's even going to need this insurance? It's 1 in 400 to 1 in 200,000. It's a huge gap there, okay? So 1 out of 400 kids is going to need it, but it could be up to 1 in 200,000. It's a huge gap, but it has to take in play then your family medical history and your risks of disease and disorders. That's going to be the biggest indicator on which direction your chances are lying in. Are you closer to the 1 in 400, or are you closer to the 1 in 200,000? I think from this, we just see it's pretty rare to need your own blood. And though it is more common to go and need a transplant, right? I think 1 in US is 1 in 270, and then your own kid needing it, 1 in 2,700. I don't know where they're getting their numbers, but this is the one I found. It's still pretty common to need the blood, but it's going to be less common that your baby can use his own blood. It could possibly be an insurance plan for the whole family, right? But then again, it can't be assumed that it'll be able to treat everyone in the family. Cord blood cells have genetic markers. Those are called human leukocyte antigens, HLA, that need to be closely matched to those of the patient. So brothers and sisters with the same parents have 25% chance of being a perfect match and 50% chance of being a partial match. So that's pretty good if you ask me. Other family members will have a much less likely chance of being a match. So if you already have a family member that needs a donor, that may be a good reason to talk about it if you're about to have a baby. It may be worth it. You can also choose to donate to a public bank where many go for transplant donors that can find a good match. So if you can't find one in your own family, then most likely you're going to be able to go to that bank and hopefully find a match there. But if there are donors, right? If people are donating, and I feel like the number is probably going down, is my guess, as delayed cord clamping becomes more popular. Also, not all hospitals participate in collecting for public banks. So if you're interested in this, then you'll have to want to check with the local hospital or the actual public banks themselves to find out how you can do it. So how do we collect, as the nurses and the doctors, how do we collect the cord blood exactly? Well, your midwife or doctor is going to clamp the cord in under 30 seconds, most likely, in order to be able to collect enough, right? There's a minimum amount of blood that must be collected. So we can't allow delayed cord clamping too often. The cord is clamped about 10 inches apart. The cord's cut, separating mother and baby, and then a large, big old needle is going to get inserted into the cord. And that is going to have a little hole in the needle, and it's going to collect about 40 milliliters of blood, hopefully, from the cord and the placenta. The blood is then sealed in the bag and sent to the lab or cord bank for testing and storage. They're going to freeze it and they're going to store it. The process itself of collecting the blood only takes a few minutes, and it's painless. You can't feel the needle in the cord at all. It's painless for mom and it's painless for baby. Well, baby's going to be separated anyways, right? Your maternal blood is also going to get collected. So sometimes your nurse, as they're taking your blood at the hospital for the hospital's needs, they're also going to be able to collect, it's quite a few vials actually, for the private bank or public bank. And they just need to do genetic testing on mom first. If you're collecting privately, so if you decide that you want to collect your cord blood, please do your due diligence on which company to go to and register for the kit maybe around 6 weeks before you deliver or sooner. This is going to allow plenty of time for you to get that kit. Bring the kit to the hospital, and your nurse is going to review the forms and labels and instructions and all the contents with you. Please be aware of these, because at the end of the day, how everything is labeled and collected is all going to be on you, right? The nurse is going to take responsibility, but she's going to go home. She didn't want the cord blood anyways. It's you guys. If it's incorrect, you're ultimately going to be the one to suffer that loss. So if you don't, you just do your due diligence. Make sure that cord blood is in there, for instance, before they lock it up and send it away. We found one hospital I worked at got in a lot of trouble because the cord blood was never actually put, that bag was never actually put in the box, and it was sealed up and sent away. And the nurse says she put it in there, but we found it outside later. I think they found it in the trash or something. I don't know what happened, but it wasn't me. But you need to check. Just be on top of it. Before you close it and lock it up, you got to look inside, make sure all the contents are there and labeled correctly. Okay. If you don't already have a company, if you get there and you're one of those parents like, should we do it still? You're still on the fence. You haven't made the choice. And then you're like, you know what? Let's do it. I want to save this cord blood for whatever reason. Then sometimes the hospitals will have kits that are ready for you. They have reps and they come bring them a few. But your choices are going to be limited on which one you get. It's just going to be whichever one's there, and whatever price it is there. And then you can call up and you can register right there on the spot. And then as long as it's before the baby's born, then we'll be able to collect it if we can. But again, this is a big decision. So I hope you don't make that choice on the fly. And if you're not sure, remember the benefits to your baby. Remember all the benefits that they will get getting their own blood. Keep that into consideration. Okay. What is the recommendation of the doctors and the medical expert community? Well, ACOG, that's the one with the obstetricians and gynecologists, they recommend collection and banking of cord blood only when an immediate family member has a known diagnosis for which stem cells are currently being used for treatment, and not for potential cases. So not as an insurance plan. The American Academy of Pediatrics agrees, stating that the use of banked umbilical cord blood as biological insurance is unwarranted. Many claims from private banks are also unfounded, so be careful of those. That's the advertising I was telling you about. They profit from this, right? This is still a business, these private banks. But unlike ACOG, the American Academy of Pediatrics do recommend cord blood to everyone. They say everyone should donate the cord blood. They know the benefits of delayed cord clamping, and they're like, you know what? There's a bigger benefit to having that in the community and having it in a public bank. So they're against privately banking it. They don't see that the benefit outweighing the risk, but there is a huge benefit if you're going to collect it to give it to a public bank for research as well, not only for treatments And then that way, if you need blood one day or your baby needs blood one day, then there's going to be blood available at the bank. And then they said that when pediatric transplant specialists, so these are the ones that are doing the bone marrow transplants and with babies and kids with leukemia and sickle cell anemia, and it's this devastating diseases, when the specialists that do these treatments, that do these transplants, when they were surveyed, they did not recommend private cord blood banking. So good thing to note right there. They're not about private. But they do, everybody across the board supports private banking only if a full sibling has a medical diagnosis for which stem cells are currently being used for treatment. It's excellent. It's an excellent shot. 50% chance of being a partial match, 25% of being a perfect match. Get their brother and sister that are suffering with a disease this liquid gold from their sibling. Again, you're going to want to measure out the benefits versus the risks. But if your life is on the line, if your other baby's life is on the line, then it is a valid reason, right, to use that blood. It's an ethical decision and it's a personal one. Okay. So speak with your provider, talk about their guesstimate as well, and ability to allow maybe 30 to 60 seconds delay of clamping while still being able to collect enough blood. This is mostly for that insurance plan type or even public. Delaying cord clamping is going to reduce the volume of stem cells remaining in the umbilical cord, but that doesn't necessarily mean that the volume that you collect is going to be unsuitable for storage or donation. So some of these babies have big placentas and a lot of blood, and they can get a little bit for themselves and also store a little bit too. Your doctor, their experience with collecting blood and delaying it is going to have more experience and knowledge on how to do that. Those that do not are going to recommend, no, we should probably just clamp right away if you want to collect cord blood and decrease the chances of not getting enough. But if you're like, hey, just try, and if you don't collect the blood, they're not going to process anything. You're not going to have to pay for anything. And you might as well try to delay it for 30 seconds or 60 seconds and then clamp it and see if you can get enough. And maybe you can. And then you get the benefits of both. And if you can't, well, your preference was for that baby, or priority was for your own baby to get its own blood. And it did. And you just weren't able to get storage. Okay, then. If it was just for an insurance case, that's an option. You can try, but you got to talk to your doctor. They have to be on board. They have to understand what your plan is. It's not something you discuss at the moment. But if we're talking about storing your blood, storing that baby's blood for someone like a sibling that needs it, then they need all of it. Okay, don't mess around with that. It needs to be immediate cord clamping. Delaying is not advised. You want to get them as much blood and as much of that stem cells as possible. And don't forget the tissue, the actual cord itself. Remember, we talked about it. All those stem cells are hanging out right there in the Wharton's jelly. This usually can't be donated on its own, so you can't just send in the cord blood just yet anyways. I hope maybe one day. But you can include the cord when you're collecting the cord blood. So take advantage of the abundant amount of stem cells there, and that current research is being done right now around it. So maybe there's not a disease that you need that for right now, but in 10 years, 15 years, a couple of years, who knows, something may pop up. And if anything, you're going to be helping push that research and knowledge even further. So it's a good idea, if you're going to collect it anyways, to also collect the tissue. You should also discuss what are some reasons around not being able to have the option to collect cord blood. So something like that would be like twins or multiples. That's due to their smaller placenta size and not getting enough collected. They're not going to be able to collect enough when the placenta and the blood volume is lower, right? Just like with preemies. Sometimes infections or issues with the placenta will take you out of the option too. And if your delivery becomes an emergency, like mom is struggling, then those precious minutes of the doctor will decide to focus on your life instead of collecting blood. That's just the whole theme of emergency, right? They're going to have to pick what is top priority, and it's going to be you if you're hemorrhaging or having a seizure or any, and we won't get into that stuff. But if an emergency is happening, we're going to focus on you. So discuss your options for delayed clamping and collecting with your doctor, like I said, and with those around you and on your team. And just don't get all your information from the cord blood company alone. Look into it, look what they're offering, look at the timeline, the years, the prices, all of that, of course. But you don't get all the information just from them because they can be a bit deceiving. Research various resources and understand that banking cord blood does not ensure a cure, and that you would most likely be banking your blood for a family member, not for the baby themselves. If you're deciding to keep the blood for your baby and the baby gets all of it, how long will your doctor be waiting, and what would you prefer? That's a question then, right? Are you delaying it 60 seconds or waiting until it stops pulsing? What does your provider practice? And does your provider practice cord milking? If your baby is term and comes out not so spunky, and before they separate, can the doctor give him some blood? Bit of that extra oxygen and nutrient rich, some iron, right? All right, so I think we got into a lot of everything around cord blood. And thank you again for listening in on everything cord blood clamping and the history, to collecting it, to milking it, to why we even do any of this. We're crazy. We're learning so much. But any questions, please reach out to me on Instagram or email me at Colette@myfriendsandnurse.com. Yay. So thank you once again for listening. Just closing the show out. Just to start the conversation with your support partner. And then we'll go to your doctor and your midwife. Talk to your doula. Talk to your trusted family and friends. Like, did you guys collect cord blood? Why or why not? The topic's up in the air. We're open to it. I'm leaning towards this way. Make it a conversation. That's how you're going to learn. Tap into resources online. ACOG and American Academy of Pediatrics is going to be some medical resources that you have. The WHO, World Health Association, sorry. And yeah, go online, check it out. More information is good information, right? There's not a lot of bad information out there as long as you're doing the research. You may get false information, but if you're doing enough research and you're not relying on just that source, you're going to be fine. You're going to use your common sense and you're going to go with your gut and what feels right. So yeah, and then get it on your birth plan. Please get it on your birth plan, because then you need to talk to your doctor. Maybe a new doctor in the hospital. Make sure that they understand that you're collecting cord blood. Talk to your nurses, get them on board. Make sure that do not cut my cord for nothing. Want that thing light. I would look at it before they cut it. You make sure everybody knows that, so that it's the chances of you getting what you want and your dream birth are going to go up. Join me on a Sunday for a live and I shouldn't say in person, but it's live. You're going to be there, but it's going to be over Zoom. I do birth plan workshops every Sunday. I think I'm doing it every other Sunday. Go to my website at myfriendsandnurse.com to find out exactly what days I'm doing them. They're completely free. Just come on. I'm going to teach you all the necessary things you need to know to make sure that your birth plan, it works effectively. And we do not want it to be just another stereotype of that, take it to the OR, because it's not. It's a tool that we use for communication, and it's just a symbol of all that work and preparation that you did, and using it as to talk and speak with others and to show them what your dream birth is all about is getting you one step closer to getting that birth, right? We're going to continue this series, the first 15, in another 2 weeks, where I will go into the history and current practice of episiotomies. Oh boy, yeah, cutting the vagina. Yay, let's talk about it. I want to know why. I want to know what started this practice. Why do I feel like it's a man? I don't know, but I'm curious, very curious. We're going to do our research and talk all about it. And what are the current practices? And is it something that we need to talk about with our doctor? Is it something that we need to worry about? And why would we even need it, right? So yeah, join me in 2 weeks. In the next episode, we get to visit with my friend Suzanne, and she lives in Hawaii and just recently gave birth to her beautiful daughter. Her story is one of the most common stories I hear and actually see at the hospital. It's an important step for her to discuss it, and I appreciate it so much. And I learned from her experience, and you guys can learn from her experience as well. And I'm just so lucky she agreed to share it with us. So until next week, stay healthy and stay informed. Thank you for listening to My Friends and Nurse presents the Birthling Podcast. We hope you enjoyed today's episode and found it valuable. Before we go, a quick reminder. The information shared on this podcast is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any medical concerns or questions. If you enjoyed the episode, please subscribe, leave a review, and share it with your friends. Your support helps us reach more people and continue to bring you great content. Until next time, stay healthy and stay informed.